Good afternoon. Welcome to this session on social contracts. We're delighted that you're here. There's still more people coming into the room, but it's good to get started. This is a joint session with the European Health Forum Gastein, supported by the Bosch Health Campus. They made all these changes. You've got to be totally correct. And I welcome the colleagues from the campus. We had this idea that around the world there is a lot of discussion about what do we actually owe each other. How is social solidarity developed? What is social solidarity within countries, within Europe, and of course around the world? And as you know, there was a strange mix within the COVID-19 pandemic that at one point it seemed that global social solidarity was very high, and then at another point it sort of dissipated. And there was very serious discussions around the issues related to vaccine distribution and other things. So we thought it would be good to take this up. What do we owe each other? What is our social contract in terms also of global public goods or common goods, as some people say, and reflect on that and reflect on European responsibilities and what we must do together. We have a really great panel here that is highly knowledgeable on these issues. And we will hear first from Dr. Clemens Auer, who is the president of the European Health Forum Gastein. He will give us some indications of the issues that were discussed in Gastein. Then we're delighted to have with us Professor Dr. José Manuel Barroso, who is now the chair of the board of Gavi, the Vaccine Alliance, obviously one of these attempts to create global solidarity. But what is, of course, also very helpful for this panel, which is bridging Europe and the world, are your previous responsibilities in the European Commission. And we're delighted that you've come to join us. You were also the first president of the Commission to actually come to the World Health Summit a number of years ago in your function then. We will also have online, this is a Portuguese conspiracy, we will have Dr. Pedro Conceição, who is with the United Nations Development Programme, the report office there, and he's responsible for the excellent regular human development report. And he will share with us some of the findings of the last few reports and what that means for global solidarity and social contracts. We have with us also Bogi Eliasson. He was also at our discussions in Gastein, so he's a bridge of those discussions. He's at the Copenhagen Institute for Future Studies, but he's involved in a number of initiatives also with the European Office of WHO and particularly with the Nordic countries. And one of the issues that has been raised continuously is, do we need a new social contract? In many European countries, people say the social contract is broken and we need something different. And we're hoping to hear from Bogi, what's being discussed, what needs to be different, what do the old social contracts not fulfill. And then, of course, he's also involved in Latin America and other countries, so he can bring some of those perspectives also to our discussions. We're very pleased also that we have Lara Fleischer with us. She's at the OECD, the Organization for Economic Cooperation and Development. And I hope all of you know that the OECD has a center on well-being, inclusion, sustainability, and equal opportunity. It's called WISE, actually. That's a good acronym. And the really important thing, and this is also something this center does, is look at data on well-being, and she works on well-being data insights and policy practice. And many of you might know that the OECD is actually tracking well-being in its member states. And that is an indication, how people feel within their societies, how secure they feel, how safe they feel, and how they feel that the social contract is being honored. And last not least, we have with us Joy Fumafi. She is with the Global Preparedness Monitoring Board, and some of you might have been at the launch of the most recent report of the Global Preparedness Monitoring Board. And in this context, I'm also a member of that board. We try to measure and give indications of preparedness. And increasingly, we find that the element of trust is a key component of preparedness. And that, again, also as the overall subject of, or umbrella of this summit, is an expression of how safe and people feel within their societies. And at the European Health Forum Gastein, maybe Clemens will make reference to that in our discussions. We were confronted, I must say, with the most recent study by the European Observatory on Health Systems, which had some rather scary data about the interface of trust and political orientation and the delivery of health and the delivery of health systems within countries. Maybe you can say a word or two about that, Clemens. So we want to have a rather open, free-flowing discussion, and maybe there are things we won't agree on. Let's see. But I hope we will be able to make some space for some, not necessarily questions from the floor, but some contributions from the floor that you might have. We've always tried also in other sessions, particularly to give young people a voice. We don't want to youth wash, sort of sit a youth person on every panel and then don't give them the word kind of thing. But we hope that we'll have some voices from the floor as well. And thank you again to the panel for being ready for this discussion, to Bosch for their support. And I'd like to give you the word, Clemens, to say a few words about the Gastein discussions, and maybe also tell people what Gastein is, because some Europeans here might be interested to come next year.
Thank you, Eleanor, for your... Thank you, Eleanor, for your very kind introduction. Yes, my name is Clemens Martin Auer, and I'm speaking here in my capacity as president of the European Health Forum. And yes, the European Health Forum is a 27-year-old initiative bringing together policymakers, the industry, the civil society representatives, and academia to talk about the burning issues of health in the European Union. We are very European-focused. And I don't know if you ever have been there, President, but all your commissioners have been there. Yeah. All your commissioners have been there, many, and we are very delighted that we also have the support of the European Commission and WHO, Euro, etc., etc. Ladies and gentlemen, yes, we started this discussion on the renewal of the social contract at the European Health Forum, Gastein, a couple of weeks ago, and we asked ourselves, why do we do this? Because this is such a highly necessary debate, very political and very political difficult times. And we also noticed from the very beginning on, together with Bosch Campus of Health, Health Campus, and with our friends here at the World Health Summit, that this is not only a European discussion, it has a true global dimension. And this is why we've said, we inaugurate the debate at the European Health Forum, but we bring it where else, to the World Health Summit, because I think here is marketplace, so to say, to talk about that. And we are doing this in very challenging political times. And I would say at least the Europeans among us here and the North Americans among us here know that our democracies are truly under siege. And we had this, and that was Eleanor was mentioning, we had a presentation of a study that there is an interesting linkage between poor social services and health services and the electorate which is tempted to vote for left or right-wing populists. So we should notice this in the health world, that we are also responsible for if we don't deliver, so to say, we are also contributing to the rise of populism, and therefore also contributing indirectly to the weakening of democratic principles. This is a time of political division and culture war. This is truly what we experience, at least in North America and many places in Europe. I think probably almost all the member states of the European Union are experiencing this kind of discussions and the division and culture war debates. But we need to counterbalance that, and we have to talk about that politically, but also in the realm of civil debates. And the debate, this is what triggered us, and intrigued our interest in this discussion about the renewal of a social contract. This debate about the renewal of a social contract, it builds upon consensus and not on division and culture war. And so it is about the principles of solidarity and the solidarity systems, and of course of health and well-being. Let me say, for Europe at least, and this is what we also discussed in Gastein, it is about a Europe which cares, a political system, a social system, a solidarity system which cares about people. And if you read, and I invite you all to read this, the president of the European Commission, von der Leyen, wrote her mission letters to the commissioners. And if you read that very critical, in many ways it's only about economic competitiveness. It's only about economic competitiveness. Yes, of course, there is the social pillar mentioned somewhere, and other aspects of the social welfare and well-being, but the main dimension is about economic competitiveness. And I guess that this is not complete if we look at the world of today, because I think solidarity and our solidarity system and the dignity of people was always a strength of Europe. It was not only about economic competitiveness, because I think we can be very proud, and this is also a message, the renewal of the social contract. It's not only about social codes, which brought us to this level of social protection which we all endure, but it's also about the aspects, and this is what I think the panel will discuss, about what is missing in our understanding of the social contract, what is missing when it comes in health, for example, of caring. And then I speak very clearly in that what the debate in Gastein was all about the harms and sicknesses of people which are induced by commercial behavior. Then, I'm speaking very quickly about the food industry, the beverage industry, the alcohol industry, etc., etc., etc. But we never talk politically about these induced things. We called it behavioral things, the non-communicable diseases. No. They are induced by commercial determinants and by commercial behavior, or let's call it sometimes even misbehavior. So this is what the discussion is about, and I'm very grateful that today we have this discussion here in Berlin, because it has not only a European dimension, it has a true global dimension. And in the end, my friends, it is about dignity and solidarity, which has to be which are the elements which really can counterbalance the economic needs of competitiveness and fiscal markets, etc., etc. Thank you very much, and I hope we can have a very fruitful discussion.
Thank you very much, Clemens, for those introductory words, and some of the issues that you've mentioned, you've said, and that of course also has a relevance on the global level. You've spoken about a Europe that cares, and that of course is also related to, or should be related to, the global role of Europe. And that is heavily debated right now, if you also think of the migration discussions. But it's not only Europe that cares, it's also about governments that deliver. And very frequently in the discussions around populism, around democracy, there is this statement that those institutions that were created maybe 20, 30, sometimes 50 years ago, 70 years ago, the National Health Service in the UK, for example, that they don't deliver anymore. And this interface between delivery and contribution of solidarity is something that seems to be brittle. The important thing, though, is if we talk about social contracts, and Clemens spoke about the consensus, it's about a consensus within a society. And it would then also be a global consensus. It's not, social contract isn't the state owes me. A social contract is what we owe each other. And countries have developed that in different ways through tax-based systems, all kinds of sharing models. And again, those seem to be partly breaking down, also because they have not taken into account other parts of the population. I mean, women still are not a full-fledged member of the social contract. If you think of the care economy, there are racial dimensions to existing social contracts. There are many issues that we could pick up. And one of the things that was also raised in Gastein was, how do we relate that to the planetary agenda? Isn't the whole planetary discussion actually part of a new kind of social contract we need to build in our societies and in the world? And that's why I'm so happy that Mr. Barroso is here with us, because he works in this universe. Okay. And I'm not going to pose a concrete question to you, Mr. Barroso. I've seen you've made your notes here, and just ask you to respond what you've already heard and what you think we should consider as we discuss global social contracts.
First of all, thank you very much for inviting me to this very distinguished panel and with this great audience here. And it's, as it was said for you, my second time. I came here when I was president of the Commission. I'm now delighted to come as chairman of Gavi, the Global Alliance for Vaccines, that I accepted that challenge in 2020 during COVID. And so, as you said, I'm trying not only to look at Europe, but at global. Today, it's not probably so fashionable to say that you are a globalist, to think about the world, to consider yourself a citizen of the world. I am a Portuguese European citizen of the world. And I think it's perfectly possible to love our country deeply, at the same time we in Europe to have a strong commitment to the European Union and to be citizens of the world. To think about mankind. I know today it's not very fashionable to quote Russian authors, but I'm going to quote one. Dostoevsky. In the Karamazov Brothers, there is a personage that says, my father liked mankind in general, but he hates every person in particular. So, and that is something we should avoid when you are dealing with public health or any other global. Sometimes you speak about mankind in general. It's a statistic thing, okay? But mankind is in fact the aggregation of billions of men, women, and children. That's why, by the way, I'm so happy that in the European Union, in the treaties, we speak about the rights of persons belonging to minorities. Don't speak about minorities, speak about people belonging to minorities. And we speak about equality of rights between men and women, although we are not yet there, but that's our policy. And the special rights of the child. Okay, so in Europe, as was already said, we are certainly not perfect, far from that. But if you put it in perspective, let's be honest, we are much better on these matters the health situation in Europe compared with Africa, but also compared to the United States. The United States, on average, are richer, but even countries like mine, or Greece or others, are above the United States in health indicators. We have a low child mortality. We have a higher life expectancy than the United States. Why? Precisely because of our European model, the social market economy. That was, in fact, a concept created here in Germany after the Second World War, social market economy and the European social model. Yes, we are a market. We are what people call capitalist economies. But there is a strong welfare state. The National Health Service were invented here in Europe, maybe in the UK. But in all countries, some better, some not so good, but there are National Health Service. One of the very interesting developments recently was the development of a European Health Union. That was not possible before. Just to give you some of my experience, when I was in the Commission, I tried to create a network of experts for best practice on mental health. And there was the ambassador of one of the most important countries in Europe that came to my office saying to my chief of cabinet, President Barroso cannot do that. This is a national responsibility. It's not in the treaty. And it's true, it's not in the treaty. The treaty, the power of the European Union in health is very, let's say, residual. Even the European Medicine Agency is not created under an article on public health. It's created on the internal market because of... and it was against that country. But in fact, afterwards, I invited the Princess of Belgium, now Queen, made a beautiful event, and the ambassador came, and afterwards they accepted. So we have this network. Anyhow, now, during the pandemic, what happened? It's not in the treaty. That's not a competition of a competence of the Commission. But the Commission bought vaccines on behalf of the 27 member states. Can you imagine the opposite? Germany competing with Bulgaria, or Sweden with Romania? So we have something, but it was necessary a pandemic. And not only that, but the European Union, finally, the countries of Europe, including Germany, that had not accepted that during the financial crisis, accepted some debt mutualization, 750 billion euros, 750 billion euros, so it's $900 billion, to finance the recovery after the pandemic. Debt mutualization, the Commission raising the capital on the markets on behalf of the 27 member states. So there is some progress, but it took a very critical crisis to respond. So I think in Europe, with all the problems that were highlighted, including this behavior or misbehavior, these are some of diseases of wealthy countries. But when you compare with what's going on in the rest of the world, I think we should be proud of our national health services, and we should be proud of the new commitment of the European Union on health. Having said that, I think that, of course, we have to be self-critical, avoid any forms of complacency, and we see problems like you mentioned. Gender issues are still important in the field of health and other matters of poverty, because we also have poverty lines in Europe, including some issues related with migration and other problems that are putting the point you've made about the polarization of society. Because what we are seeing today, and that's going to be my last remark, because I see that you are already impatient, but what we are in a world that is at the same time fragmented globally, geopolitically. We are in a very risky situation, of the worst, I think, after the Second World War, worse than the Cold War. We are now in a situation. What's happening in Ukraine, in the Middle East, and in other parts, including in Africa. The world is becoming increasingly fragmented, but also at internal level in our countries, they're becoming increasingly fragmented and polarized. Partly because in Europe, because of demographics, we are going down, so-called winter demographics of Europe, demographic winter, and at the same time we need more migrants. But like it or not, a lot of our population does not want more migrants. Namely, if they come from other ethnic or religious background. And that's an issue, how to deal with this. To deal with this in a way to avoid the rise of extremists from the far right, but sometimes also from the far left. And sometimes you don't see the difference. They go from one point to the other. So the question is very difficult. We have to rebuild that social contract. I personally believe it has to be around the values of Europe, including the old national health services. I don't see a better solution. Of course, in conjunction with the private sector and in industry, that is so important also in Europe. But we need to renew that commitment, because at the end of the day, that's what For instance, during the financial sovereign debt crisis that I was in the Commission, what happened with Greece, in my own country, in Portugal, in Ireland, also in other countries of the so-called periphery. If it was not the National Health Services, and if it was not the social system of the employment subsidization, and so, I mean, it will be revolution or counter-revolution, it will be a complete chaos. I had that discussion at that time with Obama in one of our summits. And I had to explain to him, for instance, that Greece had a higher life expectancy than US. And then he said, oh, it's probably because of the Mediterranean diet. And I said, and why do they have a lower child mortality? Because he said, in my country, those measures, there will be already a complete war, he said, in the United States. And probably it's true with the measures that we applied, reducing the pensions, reducing the salaries. But Europe was possible to sustain that extremely difficult situation because of our social model. It's imperfect, far from perfect, but nevertheless, it was a very important cushion to avoid further problems. So I'm sorry. So this is the political, because I was prepared to speak about Gavi, and I hope to have the opportunity.
Yes.
Because it's a very good example to preserve in this very geopolitical fragmented world some level of communality when it comes to global public goods, and it's a good example what we are trying to do. But since you provoked me politically, I mean, I'm no longer in politics, but I could not resist.
No, but that's wonderful for a panel like this. And quite honestly, was hoping that you would do that, because it sort of widens how we need to think about social contracts and, of course, health systems. And I was actually very intrigued that you mentioned also the role of health systems during the big financial crises. I was involved at the time of an analysis of the Portuguese health system, and it became very, very clear of this role as glue, and it was. And it led to quite a different kind of conflict. I was talking, the health system continued to function. I was talking to a general practitioner, and she was, totally upset from the other side. And she said, if this old lady comes to me, because our health system is functioning, I can give her medicines, I can't give her food. And these are the kind of challenges that emerge then. And in some of the countries, you have neither the health system nor the food, and then it gets very difficult. We'll move on to our second Portuguese speaker. Pedro, are you online? Let me see, and look to the yes. Hello. And Pedro will give us a global perspective on this notion of social contract based on the recent human development reports and the information they have gathered, and obviously, and also give us some indication in what direction we could be taking action, how we could be moving forward. Pedro, I'm delighted you can join us, at least virtually, and over to you.
Thank you so much, Ilona. It's a great pleasure and honor to be with you and with my fellow panelists, and particularly to be part of the Portuguese contingency on this panel. I was very stimulated by what I've heard from you, Ilona, from Clemens, and from Professor José Manuel Durão Barroso. So maybe I'll start by sharing a reflection on this notion of a global social contract. What does it mean? And you started alluding to it a little bit, Ilona. Because as we learn in school, social contracts are something that is struck within societies, right? Between people living in a certain jurisdiction and the government responsible for that jurisdiction. Even recent theorists of the social contract, like John Rawls, for instance, he wrote a book called The Laws of Peoples, because his premise is that the social contract is something that can only make sense within a society. But as you alluded to, Ilona, I think that there is more that we owe each other, and I really like that expression. I can share perhaps some structure of this notion of what we owe each other based on the work of Amartya Sen, because his work is something that inspires what we do here in the Human Development Report Office. And he argues that there are at least three reasons why it's important to consider some notion of globality when we think of issues associated with something related to a social contract. First, the first reason is because many people identify not only with those living in a local community, and when I say local community here, I mean a country or a larger community like the European Union, for instance, but also with people that live elsewhere, potentially very far away. Secondly, I think it's important to have some notion of globality. I mean, I'm paraphrasing Amartya Sen here. Is associated with the fact that choices and decisions and actions that are made in one particular community may affect the lives of others, potentially living very far away. So this notion of spillovers, or what economists call externalities that have global reach, becomes salient in a context in which our societies are very, very interdependent. And I think that this interdependence was put, global interdependence, was put in sharp relief during the COVID-19 pandemic. And the third reason has to do with the fact that each community can benefit from having perspectives that go beyond what's informed by a particular geography or history, from the perspectives of people living elsewhere, helping to overcome parochialism, and leading to this idea that Professor José Manuel Durão Barroso alluded to, of assessing well-being from the perspective of humankind. Amartya Sen uses this expression of assessing well-being with the eyes of humankind. So this is just a summary of three reasons as to why we need some notion that goes beyond a more parochial perspective on the social contract. Now, I'll just make two quick points, and then I'll stop. This may seem very abstract and idealistic, but in our latest Human Development Report, we actually argued that it can be very concrete and specific if we use the lens of global public goods. So global public goods are things that define arenas where countries can come together despite having many differences and competing with each other on many things. But the fact that they compete with each other on many things, they have conflicts with one another, sometimes violent conflicts, as we see in today's world, unfortunately, that is not incompatible with the notion that countries may find reasons to come together to address challenges in which it's in everyone's interest to come together and cooperate. And global public goods provide this analytical lens, this framework to understand what kind of issues these might be. And so they include things like pandemic control or climate change mitigation. My last point has to do with why is then so difficult for us to come together and have countries provide global public goods, even though we do it sometimes, and Gavi, as has already been alluded to, is perhaps a very good example of that. And I think that, and this is my last point, one of the challenges that we confront is the fact that the social contract is brittle. I think you used this expression, Ilona, is brittle within countries, within societies. Societies around the world today are polarized. Clemens alluded to this in the context of the United States and Europe. But our report documents that this is happening, this political polarization has increased in 2/3 of the world's countries in the last 10 to 15 years or so. today, a quarter of the world's countries are governed by platforms, political platforms, that can be considered populist. 25% of the world's countries. In the 1920s and 1930s, when we had also a heightened number of countries governed by populist regimes, this was about 10%. So I think the situation today is very dangerous because the social contract within countries is brittle because of this very dangerous political polarization that we are seeing in many countries around the world. And this is not about an ideological thing. It's not about people preferring the left or on the right. It's people being attracted to the extremes of the political spectrum, both on the left and on the right. These 25% of governments around the world that can be classified as populist are evenly split between left-wing and right-wing. So it's no longer a sort of ideological divide, but something much more deeply, much more concerning, which is about the drivers of this political polarization. So maybe later in the discussion, we can go into the reasons why and perhaps what we can do about it. Back to you, Ilona.
Thank you very much, Pedro. And I hope that you, the audience, will bear with us because we think, this World Health Summit is also a venue where we dig a little bit deeper and we don't just have general statements on panels, but we reflect together on issues that are happening around the world and that impact our work in global health. And obviously, there are two things that Pedro referred to. Again, thinking about how we reframe and think again around this notion of global public goods that was discussed much more about 20, 30 years ago, but then, totally disappeared in a way from the frame. But also to think about this notion of choices and their impact and, the externalities discussion that he brought up. And with a view to those two things, I'd really like to turn to you, Joy, because in our discussions in the Global Preparedness Monitoring Board, and of course in your own work on the African continent, these are things that are in the forefront. What do we owe each other as a global community in the case of pandemics? How do the decisions made one place impact elsewhere? Even if one is responsible as a country itself. And what have been concerns of the Global Preparedness Monitoring Board in this context? Please share with us your reflections. It'll come automatically.
Okay. Thank you so much. Thank you, Ilona, and it is a pleasure and an honor to be a member of this panel. I'm going to address this issue from the perspective of social and economic equity and trust, and the lack of the social and economic equity, that is inequity and the distrust that currently persists, and that is hampering, this social contract that we so desperately seek. Now, I'll just take us to the global economic loss that has occurred due to COVID-19 pandemic. It has been immense, as you all know. In fact, the IMF estimates that the global economy would result in a loss of output of $22 trillion between 2020 and 2025. This is relative to pre-pandemic levels. And of course, this burden is disproportionately shared within the global economy. 100 million more people have been plunged into extreme poverty, and most of these, of course, are in the low-income countries. And 1/3 of the IDA countries have become poorer than they were before the pandemic. So this is the current situation. The long-term costs of the pandemic are manifest in increased public debt, and when you have increased public debt in these economies, what it means that their budget has shrunk. And right now we have countries where most of the recurrent budget is going towards debt relief. Now the little that is left has shrunk, and that means that the social investments in public goods, in health, education, knowledge, environment, this has all shrunk. And the ongoing disruptions in the global supply chains have not helped, particularly when it comes to access to medical countermeasures for our communities in the developing world. At the same time, the extreme regression into inequity and poverty and the distrust that was fueled by the COVID pandemic is in return fueling migration, displacement of large populations within the South, conflict, rising conflict in the South. So in many countries, even the investments that were made during COVID in strengthening resilience, particularly the social protection programs that were put in place, have now been rolled back. They're being abandoned because countries can no longer afford them. So only 39% of the working population would be covered by social health protection scheme if a global pandemic was to hit us now. Only 39%. So we are much worse off than we were before the pandemic. What is the lesson that we have learned from the pandemic? It means that we have larger inequity. Distrust is immense because of the inequities that were fueled by the pandemic. So the cycle of vulnerability is being compounded when these countries are being further squeezed from every perspective. So this social contract has actually diminished, is lost. We have lost sight of it. So I don't need to speak about how the trust was lost. We know that trust is built when government influences the confidence of the people, and this is also the legitimacy of the trust is given when the people know that they can depend on government, and government knows that it can depend on partners, governments can depend on each other, global stakeholders know that they can depend on one another. And conversely, the lack of trust can drive both the emergence of novel viruses, as we can see now with the disagreement that we have in the negotiations of the pandemic agreement, and it can also amplify the outbreaks. So this is the situation where we are now. So I would say we need this to revisit the global social contract more desperately than we did before the pandemic, because we are in a critical crisis moment where we really do need to appreciate that when the next pandemic hits, it's going to be worse for us than COVID, because we are less prepared now than we were before COVID when it comes to the social equity, economic equity, and trust between our people, their governments and stakeholders. Thank you.
Thank you very much for that, Joy. And of course, a whole range of countries of the global south or are engaged in trying to address some of these situations. And it's a very, very important debate if we think about the Bridgetown Initiative and Dr. Mia Motley, which is, about the financial institutions, the global financial institutions, the voice of the global south there, the debt relief that you referred to, and many of those issues that are not dealt with in an appropriate way. And maybe what we find now, because that global social contract is so brittle, that we find these other movements of, the news yesterday of the expansion of the BRICS, and where countries place their allegiance and alliance, and how that is moving in the global environment. And of course, as many of you have alluded to already, does also play out in negotiations around health, around the global possible pandemic agreement and other things. So I think, being able to have a contextual view of why certain negotiations are so difficult right now about something that seems a non-brainer after having, lived through a pandemic, we can understand why that is not the case. And we'll come back to one or two other of those elements again. But I'd like to turn to the OECD now. And it's an economic organization, obviously. Why is it concerned with issues of well-being? How is that supported by your member states? Don't they say, what are you measuring this well-being stuff instead of doing, all the hard economics, like recently, a very interesting development on global taxation, for example, which is also part, I would say, of a global contract. And there are, definitely some problems then of the national application of such a global social contract. So it's also the question, what do we think is part of that global social contract, which agreements? But Laura, tell us a bit more how this fits into the economic work of the OECD, and why those things somehow go together.
Yeah, sure. And thank you so much for inviting me to this panel. Great to be here also with the fellow panelists. Before I answer your question, I'm going to go back to something you said in my introduction, is that we track well-being data at the OECD. And actually, I'll start with a few data points on how people themselves in OECD countries now, but we have also global perspective here, are experiencing their lives. And I think that already answers the question, why do we need to care about this? And even in a more economic organization like the OECD really needs to care about it, so we can't afford actually not to care about it. So in 2023, again, I'm only speaking about OECD countries now, less than half of the population said that they trust their government. And that's actually on a decline now from the early years of the pandemic, where trust in government peaked a little bit. Close to half, so almost half of respondents say they don't think they could easily receive public benefits and access them if they need them, so speaking about social protection. Nearly 80% of respondents say that economic inequality should be reduced. More should be done to ensure equal opportunity. And then speaking of even more complex challenges to resolve, almost a third of respondents feel powerless in the face of climate change. And that's actually across all ages. That's not only the young people, as we often think, it's also for older age groups. But then only 4 in 10 think their country will actually be able to realistically reduce greenhouse gas emissions in the next 10 years. And then more than 1/3 think their government will not be able to realistically regulate AI in a way that actually helps businesses and citizens. And then speaking about the more social part of the social contract, between 4 and 14% of people in OECD countries say they feel lonely a lot. And we know that things like loneliness, social connectedness are also associated with anti-democratic attitudes and might explain some of the voting choices that we're seeing. So it's very clear that there's a problem, and that there's this recognition that the current social contract, and maybe even broader, the broader economic system, doesn't necessarily deliver anymore the good outcomes for people, the planet, and future generations. And obviously health is among those outcomes, but there's others that are also important. That recognition is actually not new, but countries, including in the OECD, are recognizing this much more, and there's a momentum towards this well-being economy approach, which we, and especially in the Well-being Center at the OECD, also deal with. So we've been supporting this agenda for more than a decade, and actually for several reasons, including political ones. It started very much as a measurement agenda. Can we go beyond GDP and complement more traditional metrics of economic growth with better and more diverse metrics of societal progress that actually reflect whether people's lives are getting better, crucially also for whom are lives getting better, who is being left behind, and is progress inclusive and sustainable. But then, okay, we can publish as many metrics and improve the evidence base as we want. Like, in the end, we don't need better metrics. Those metrics need to inform government decisions differently, and ultimately, people's lives have to be different at the end, right? That's what we care about. So today, more than 2/3, actually, of OECD member countries have adopted a well-being initiative. And there's an increasing subset of those 2/3 that are also experimenting with well-being policy implementation. And we've also managed to get well-being mentioned in the G7 finance track of the Japanese and now the Italian presidencies, which is a huge win because exactly we need all kind of sectors on board for this. What does well-being policy making look like? I mean, by the way, it doesn't need to have well-being in the name of the policy for it to follow well-being principles. It's actually just good governance, if you think about it. So it's being multidimensional and cross-sectoral, away from the silos that we so often operate in, being more people-focused, looking at longer timeframes, not just those electoral cycles that we're all stuck in, looking at preventative action that might cost more in the moment but will 100% pay off later on. And we see OECD countries doing this in very, very different ways. There's strategic agenda setting based on analysis of well-being data. For example, that's happening in Iceland at the Prime Minister's office. There's assessing well-being trade-offs and synergies in policy appraisal differently. That's happening in New Zealand, the United Kingdom, where they adopted their cost-benefit analysis to be more broad and go beyond just the traditional economic indicators. And there's informing the resource process, so well-being budgeting. That was done in New Zealand, the previous government. It's still being done in the Netherlands, in France, in different ways. So, I mean, I can expand on those examples later on in the panel and be more concrete. But the point is, it's still a very fresh agenda. There's a lot of momentum, but no one has figured out the one way to do it. Everyone is still experimenting with it, which is great. There's a lot of space for peer learning this way. And I think that the big challenge there is also how to connect that to the more global agenda and the more planetary boundaries agenda. But happy to speak about that later.
Thank you very much for that, Laura. And for people not that familiar with the OECD, it is, to a large extent developed countries, but there are some other countries, particularly from Latin America, that have now joined the OECD, and therefore it's quite interesting. We've seen the political developments in Mexico, for example, and OECD member states. We have, Colombia and Costa Rica, I think, are both members. So it is interesting to see how these countries also engage within that context. Korea also is a member of the OECD, and there are different models in these countries of social solidarity, different understandings of well-being. But I think one of the key messages, also what Laura shared with us, is this attempt that is going on in many, many countries and quarters. How do we measure the success of our societies beyond GDP? And how do we get new measures that then can actually capture the need for new policies as we measure ups and downs in terms of societal well-being? So, Bogi, it's over to you now. Of course, for a long time in the debates around well-being and in the listings of the Human Development Report, etc., it was the Nordic countries that usually featured very high in those kinds of lists. At the same time, you're involved with the Nordic countries. They're actually saying, we've got to revisit all this there are also tensions, right-wing governments, etc., in the Nordic countries, where some others sort of ask themselves, my gosh, why, compared to countries in the rest of the world. Can you share some of those challenges with us?
Yes, thank you. And I must say, I love this microphone because on Teams I'm always silent for the first 10 seconds. So is this AI or is somebody sitting there?
There is somebody.
No, joke aside. So one part of this is the digital that is coming in. So we started Nordic Health 2030 in 2018-19 based on a question. How are we dealing with these Nordic societies that are built on a social contract, that are built on a Nordic welfare approach, when it becomes geographical and digital at the same time? And you might think, what? Is that important? It is, because your digital life is not just your geographical life. And our old social contract was based on your jurisdiction or your city or your county, maybe your country, in that way. So I should say I come from a very, very small country, the Faroe Islands, almost Faroe, so I could be Portuguese. But, and in that you have a certain setting for a social contract. Then I went to Brazil as an exchange student just after the fall of the military dictatorship in 1990. And I experienced what happens in a society where you have not had any kind of a social contract, as we understand it, for decades, and what that does to your age group. This is why I'm so scared of authoritarian rules and why I fight so much for social contract. So the part I focused on in the Nordics is health. So why access to health has been very good, or the access to healthcare has been very good, the access to health has not. There is a huge increased disease burden for several reasons, which also is based on that the social determinants in different ways has not really worked out. So how are you going to work with that in different ways? And what we have then set up is a cross-national work in the Nordics with decision makers and stakeholders and saying, okay, what is it really we want? What is the challenge? The first question we ask is, do we want to build the best possible health systems in the world? Or do we actually want the healthiest population? Right? Everybody responds the second. But then when you ask, how many decisions did you take that took care of and prioritized the second the last 6 months? You don't get any answer. So we say something, we do something else. So that is some of the things that we are really trying to push. And our what is pushing, and this comes back to what is the challenge? Why is the social contract breaking apart? 87.5% of the disease burden in the Nordics is chronic disease. So we wait until people are very ill because we only deal when things are acute. And this leaves people behind. So that's another part of the breaking of the social contract, and you get the divisive left and right because people feel left out. This again comes back to the planetary approach, because if we want to reduce the impact on the planet with unnecessary health services that we are doing, we actually need to act faster and earlier in that part. So where this comes into the microphone is that the digital infrastructure that we need requires trust. And if we don't have trust in how we use that, so the governance, the traceability, and transparency, we will not use it. There's a high trust in the Nordics, so we actually do use it quite a lot, but there is beginning to become a distrust because there is no accountability to those who own the basic infrastructure, not in your country, globally. And that needs to be addressed in that way. So, and when it then comes to what we are trying to push here also is that we are totally pushing well-being economy. OECD is part of our program as well. So is WHO, and I'm also co-chairing a work group on how do we do out-of-hospital digital care in that way. So this is really about dignity. So how do you refocus dignity in a world where you're not just your solidarity is not just geographical? How do we work with that? I don't have the answer, but we need to ask the question. So this is also very much about imagining what would it look like if we were happy with it, and not just trying to solve the broken parts of the system. So it's a bit, it does require quite a lot there. So Health, the way we see it, is the most important societal pillar. And it is the producer of resilience. It's the social resilience. And to do that, we also need to change the health focus on the acute. But we do today train people for acute, recruit people for acute, we pay for acute, and we build buildings for acute. That does not fit with the net zero. So I would say, can we move from the heroes to the net zero? Because the health system today is based on that we have superheroes who save lives, acute. We need the heroes that save a lot of lives, but non-acute in a part of that. And that goes back to the well-being economy. So how do you build the access for people to live a healthy life? The easy way we have pushed this is to say, the Nordics are spending 10% of GDP on health. So how can we do so that half of that goes to acute, as we do today in the hospitals, but the other half goes to primary, secondary, and tertiary prevention? So how do you start as early as possible and precise as possible with chronic illness? And that requires a lot of data infrastructure and trust for the people to use it. Without trust, it will not happen. So this is why the solidarity and the trust is so important in this. And when it then comes to the solidarity, and I was in a discussion in my Robert Bosch Academy yesterday, and it was about the future of democracy. Our democracy that we are trying to repair is the democracy of the past. It's the democracy of the analog world. So how are we also rephrasing what is it really that democracy should be able to do in a country where, or in a world where most of it is digital? But I will also like to say that we need hope. A new imaging of what we want in the world requires hope. It requires aspirations. It also requires that we reread Hans Rosling Factfulness every second year, and then realize that there are things that are not so good and we should focus on them, but there are actually things that are good, so let's praise and learn from those things. You could also say that this is about reading Don Quixote and not being Don Quixote, so focus on the real challenges in that way. Yes, I will stop now. But this also requires that we move health and the social system. So people should not be a client that provides trust to the system. You should actually be a champion in the system that's a part of the trust. Thank you.
Thank you. So before we do the second round with the speakers, I'd like to give the opportunity to 2 or 3 of the young people in the room. So I have 3 hands raised here. No, you're not young.
Oh, no. Oh, she's young. She's young.
I'm going to count myself
Oh,
to
my
young
God.
people in a minute. So,
You are young.
I'm young.
Gentlemen here, please.
Hi,
Please stand up and just...
I'm a Pakistani-Canadian physician currently based in London. This question is to President Barroso. Your Excellency, you mentioned Europe, and what we often forget that Europe, and as in fact global North, has been built on the centuries of exploitation of the global South that we see today. And we're still unfortunately influencing that. How can we incorporate moral and political policies that can prevent the exploitation of global South, further exploitation, so that we can enable those countries to develop their health and well-being? Thank you.
Thank you. This...
Hi, I'm Charlotte Bull from G4 Alliance. I actually had kind of the same question, but I have another question. My question is, we talked about the difficulties, especially now that right and left extremism is rising. My question would be for how can we include the people living in a system that is at all not in a democratic way organized or unstable or in conflict, acute or chronic conflict situations? How can we include those populations in the social contract? Or can we at all?
Yeah. Thank you. You don't need to ask questions, by the way. You can just make a statement. So please, this lady here.
Hello, my name's Riley Terzopoulos, and I'm with the Global Surgery Umbrella, and we were a part of the Health Impact Coalition for the Pact of the Future. And so the Health Impact Coalition came around because when we're looking at these social contracts, like the Pact for the Future, health is mentioned less than 30 times. So how do we as actors in the health space engage in the larger developmental space in order to raise awareness and promote health as a priority for all outside of our silo of health? And I'm really interested to hear from the people on the panel who have political backgrounds, but also in your position as members of health organizations that are international. So thank you.
Thank you. And the gentleman over there.
Thank you. I am Prosperous Aisu from Uganda, a disability activist. My concern is on one, rehabilitation and assistive technology as we crave for social contract for health and well-being. I don't know whether you have the aspect of rehabilitation in perspective, because rehabilitation does not only concern persons with disabilities, but also it concerns everybody else. Yeah. Then two, I am very grateful that today I'm seeing the chairman for Gavi. I've been struggling with our government to see how we can try to apportion some small percentage out of the Gavi funds on rehabilitation and assistive technology, besides the other priorities that the Gavi funds are meant to. Thank you.
Thank you very much. So we've had some questions and some further dimensions. I'll ask the speakers, to sort of integrate them into as we go into our last session. And obviously, we're starting with Mr. Barroso, and this time with your other hat, the Gavi hat, which is in a way a kind of expression of a social contract. Yeah. It's also still, this saving lives. But I see that Gavi is also sort of changing in some of its strategies as it's moving forward, how it interprets that, actually not just delivering, but also helping build capacities in countries for producing, for example. Exactly. So if you could share some of that with us. Each of you has about 3.5 minutes.
Oh, my God. So first of all, about Gavi. Gavi, most of you may know, it was created in 2020. Since then, it vaccinated 1.1 billion children. It saved at least 18 million lives, according to independent evaluation assessments. And in fact, as people were saying now just before, not everything is bad. I mean, there are problems, and we should not be complacent with the problems. But in fact, if you look at last year, the so-called low-income countries where Gavi bases its work, focuses its work, for instance, DTP3 vaccine, the coverage was at 80%. It's only 4% below the global average. So in fact, immunization is going. I mean, in spite of the COVID-19, that was a problem, and still there is a problem now with zero-dose children. In fact, immunization is one of the very few SDGs that we are probably going to achieve in 2030. It's most of the SDGs, and for me, the SDGs are the current global social contract. If you ask me what is the social contract globally, today is SDGs. It was approved by all the countries in the world to reach them, but we are not going to reach them. That's the point. But one, according to WANIC, the recent report, one that's still possible under the health objective is immunization. In fact, and it's interesting to see, for instance, countries that have been supported by Gavi, low-income countries from 20 years ago, one-fourth of them, a quarter of them now are fully financing their own programs. So it's becoming sustainable. Last year, $200 million were paid for vaccines by former low-income countries. So the model of Gavi is giving them, but afterwards there is an issue about eligibility and transition. And that's what is convincing donors. And now we are in a new replenishment and trying to find 12 billion US dollars. So if you can help me, great. We already found something, by the way. We are preparing the next replenishment for the 5 years. And one of the arguments that Gavi has that is very important for donors is, look, thanks to your support, those countries no longer need your support. That's very important when you speak about development. And so that is about sustainability. Now, as was highlighted mainly by Joy, there are huge problems of inequity also in the vaccine sector. We saw them during the COVID-19, namely Africa. That's one of the reasons why we launched, in fact, it was launched now in June in Paris, but it was a joint initiative of Gavi and the African Union, AVMA, African Vaccine Manufacturing Accelerator, initially $1 billion US dollars, to build manufacturing capabilities in Africa. I hope that it will not be easy, but we are on the right track. Now also, thanks to the creation of the first response fund, it was possible for Gavi to buy, just last month, 500,000 Mpox vaccines. So the fund was created in June, and in September it was possible already to use those funds to buy Mpox vaccines. That's one contribution also. So these are, so from my point of view, and many of you spoke about trust. Trust is in very short supply today. One and a good example of that, or a bad, if you want, example. And yesterday I was in a conversation here about shared by the health minister of Germany, the pandemic agreement. It's amazing. I mean, if not now, when? After this pandemic, the governments of the world cannot agree on a pandemic agreement. I still believe it's possible, but it will be, of course, let's say, a minimal solution. But then there is a political option. Is it better to have something that is not great, or is it better not to have anything at all? And that to put the last, let's say, stone over the multilateralism. Today, multilateralism is not working. I mean, United Nations, my good friend Antonio Guterres, I was with him recently in Timor-Leste, in East Timor. He said publicly, United Nations is paralyzed. So the Security Council simply cannot take a decision in any war, simply. And the WTO is paralyzed. WHO, let's see what happens with the next president of the United States. Depends on who will be the next president of the United States, if the WHO is going to survive or not, from my point of view. So we have a problem of multilateralism and trust globally. The point is, in fact, to build it. Gavi is giving its contribution. And that's why I'm proud of what Gavi is doing. Having said that, it's not sufficient, of course. And so coming back to the very general question about the relations between the North and the South, we are conscious of that. I personally am conscious. I was 16 years old. I was fighting in the streets of Lisbon against the colonial system of Portugal. Because Portugal was an authoritarian system until 1974. I just turned 18 when it became democracy. I mean, there was a military coup. So I was 16 years old. I was already detained by the police because I was fighting for the liberation of Angola, Mozambique, Guinea-Bissau, East Timor, and others. So we have to do more. But when I say we, I don't say only we in Europe or in the West, also the so-called Global South, because there are also problems on the Global South, let's be honest, and including in trust inside those countries, and in the global community. Now, I was in all G20 summits between 2008 and 2014. Let me tell you that even if I compare now with that, it's much worse now. Because, for instance, the president of China did not go to the G20 summit in India. It was quite interesting now recently. But before, they went to all summits. So today, I think the kind of this dialogue we had with China, it's not the same kind of dialogue. And that answers your question. The question is, what can we do with countries that have not exactly our values? I believe that when it comes to the humanitarian field, there should be no borders. We are distributing vaccines with the Taliban. I mean, Taliban is not my preferred party, I have to say. But we are, and by the way, and they are distributing vaccines in Afghanistan. Should we not? Of course we should. Because we are not thinking about it. I speak about the people, the children, men and women there. So, and that's one of the points I believe we have to do now, is at least for those global public commons or global public goods, to encapsulate and tell the Americans, because the situation is going to get worse. Forget all illusions, the situation geopolitically will get much worse. the struggle between US and China is going to increase. We see now China and Russia on one side, the so-called West on the other, the so-called Global South showing anger or resentment. I was in the African Union summit in Addis some time ago, and I saw directly, I spoke with 1/4 of the African Union presence, African presence. I see the situation. It's going to be more fragmented. But what we can do, at least those in public health now speaking, is to say to the lords or the leaders of the world, look, okay, we understand that we are going to fight. But when it comes to a vaccine for a child, it does not matter, or it should not matter if it's American or South African or if it is Chinese or if it is European. You should have access. It's a question. That's what I made my point before. It's about the people, not about the countries, not about the state, not about the parties, about the people, a woman, a man, or a child. And this, I think there is a possibility to do something. In Gavi, we are trying to do it. By the way, we bought Chinese vaccines when we did not have other. You cannot imagine the backlash I received from some people in the US. But the Africans were asking us to have vaccines. We had money, but we had no vaccines because there were embargoes. We decided to. So when it comes to humanitarian, I think we should try to dissociate it from the geopolitical or ideological considerations, because every person deserves attention, independently of the country he or she coming from.
Thank you very much, Mr. Barroso. So I'll turn to my other panelists to give their comments based on what they've heard. May I turn to you, Joy, first, because I think, following through from the challenges Mr. Barroso has put, to give that a perspective from either the GPMB or as from an African country.
Thank you very much. Heavy burden, being from the one African country, but and I think the only panelist from the South. I feel that the challenge here for us is how do we rebuild the trust, and how do we rebuild a trust by forming this global social contract for health now, before the next pandemic. But even just for our good as a human family, and I do agree with His Excellency Barroso when he says it's not just north-south; it's south-north. It has to be collaboration. I think the era of looking at the north as the savior of the south really doesn't fly anymore. I think that era was as long past. In fact, it should never have been. And I would agree with my, I'll call you a younger brother, though I know you are my son. I would agree with you that we really do need to develop a new social contract between the North and the South, because we have a lot of experts who are working in the health sector in the North from the South. And a lot of them have been trained by the South. But the South is not compensated, yet they have a shortage of doctors. So this is just one example of an area where we have actually not defined how we should collaborate. And I think it's similar to the point that you made about we look at strengthening our health systems, and we are not looking at what are the actual health needs of the population. So we are strengthening health systems by putting in place, first class, referral hospitals with global experts, when in fact the incidence of mental ill health, depression and mental health amongst youth in all our populations globally has just skyrocketed since COVID, and we don't have services for them. So their health is deteriorating because the type of service that we are investing in is not what they need. So, and it's the same thing with global collaboration. We are focusing on the old hymn sheet when the new era in which we are, which is digital, which has got different challenges, probably needs a different approach. So sometimes it's not a question of more money. It's a question of changing the way in which we engage and making it more relevant to our current situation. So I think that is how the new social contract should be. It should be based on the current reality, and we should engage in a new way and finance our investments in a way that is actually going to build the trust with the population and the people whom we need to engage with. And I think, you know, investing in manufacturing is one of the international ways that we can actually increase this collaboration.
Thank you very much, Joy. Pedro, comment from your side, and maybe with a perspective also of what do we do about this? You know, does your report say something about, you know, how do we move forward? Can we resolve the problem somehow? You have 3 minutes.
Yes, our report has all the solutions. So I just
Read it.
everything is there. I'll come to this point in a moment because there's some truth in what I just said. So I just want to emphasize 2 points because I don't have much time. First, to reiterate the importance of global public goods, particularly in today's world. And Ilona, you asked, it was fashionable 20 years ago, and then it went out of fashion. So what's different now? And I think there are 2 aspects that are different today. So the first wave of discussions around global public goods was around managing globalization. So how much should we liberalize the capital account? How much should we allow trade to flow between countries, people to flow? What we confront today is a completely different reality that can be characterized as a process in which we are confronting dangerous planetary change. So this planetary reality in which, unless we move to Mars, we have to figure out how we address planetary problems like climate change. And these are problems that cannot be addressed within borders. And I think they brought, or they became more salient or more heightened, perhaps, in the context of the COVID-19 pandemic. So this is one. And the thing that's also different has to do with the digital interconnection. So the digital transformation that we are undergoing that is changing many aspects of our lives. I would also say that we have to figure out ways in which countries are sovereign. So the idea that countries will sign treaties and that's the solution, I think might be misguided. Because countries can withdraw from treaties. They do it all the time. We've seen it happen. We have to figure out ways in which countries see that's in their interest to sign treaties and stay in treaties, if that is the solution. And again, I think this idea of global public goods provides not only a framework, but can provide very concrete guidance that would enable us to make progress on addressing some of the shared challenges in a world in which countries will compete. Let's have no illusions. Countries will have conflict. Unfortunately, countries will fragment, but that is not incompatible with the notion that they can come together on some aspects.
Thank you.
Yeah. Okay, I'll stop. Okay.
Yeah. No, I think your last point was very important, that we need to revisit that. You know, what are and how do we bring countries together to actually find common solutions? Lara, view from your side, you know, how's the OECD, or what's the OECD suggesting to move forward? I mentioned the tax treaty for more equity around the world. Are there other issues related to your area of work that have become prominent?
Thanks so much. I have 3 minutes as well, I guess. So
yeah,
I'll go. So part of even the Wellbeing Center in the OECD is exactly trying to mainstream a wellbeing approach into what all the other areas are doing, including tax, including education, including the health colleagues, etc. I think one of the biggest things for the well-being approach everywhere is that, especially if we want to kind of stay within the planetary boundaries parts, that is that we need more mechanisms to guarantee intergenerational fairness, and that can be on a global scale as well. So some really good examples that we do suggest to countries are, future generations commissioners. Wales has been really great with that. The UN has been suggesting that as well at the recent Summit for the Future. We continue to bring countries kind of together to knowledge exchange on the well-being policy implementation. The second thing I would say is that if we want to build trust with our populations, I think we also need to be really honest about the trade-offs that certain policy decisions that are necessary will bring. So it can't all be win-win. There will be really hard changes in consumption pattern and in economic distribution, et cetera, necessary. And they're not just all going to be easy, and people are not stupid. They know if everything is presented as everything will be great. It won't all be great, but what we need to do is rephrase our priorities as society in terms of what actually makes us happy, and can a more communal-centered contract based on solidarity actually bring us the happiness that this addiction to growth can't in the end. I'll end with a little pitch. So our big wellbeing report is coming out on the 5th of November. It's called How's Life? At the 7th World Forum on Wellbeing in Rome as part of the G7 presidency. Again, trying to bring that into the finance, the more conservative ministries. It's coming out on the 5th of November. Obviously, who will read it on that day will depend on the outcome of the US elections, I think, but fingers crossed either way.
Thank you. Thank you for that pitch. It should have been launched at the World Health Summit, though.
I know.
So, Bogi, your 3 minutes.
Yeah, so I will try to explain this with some of the things that we are doing. So in concern of the leaving the West and the rest, I was actually a co-initiator with others on Movement Health, which initiated in Latin America in 2020, which was really focusing on how do we improve the health systems there on a large scale. And there we have we are on the last phase on with the City of Mexico, with helping them to actually activate the use of data for data-driven health. And this is possible because we chose to go in and actually do it with people who wanted to do it, and made it in a way that can be scaled across countries in that way. And that's a need we see everywhere. But this is really about providing better access for many more. On another part, we've actually launched a report here yesterday on COPD. COPD is the third largest cause of death in the world. Nobody knows about it. We have made a huge work in, it's 90% preventable. There are best practices, there are guidelines, there are strategies, but practically not used. So these are things where we can push a lot with things that we know, which I think is very, very important. A last part there is what we're doing actually in Denmark, but we are also trying to open it in Uruguay now, is phase 5, which is a new way of digital decentralized clinical trials where you start at home with a person. So this is about self-care in digital trials and really helping people and giving them the tools into their hands, so the agency. And there is no reason why this should only be in the Old West. There is no reason why the ambitions in the rest of the world should be to catch up. There are many places where you actually can redefine and really say, what is the social contract of the future? What is the society that we need? And that is the agency that we need to push in these ways. In the end, what we also heard here is without targets and objectives, we probably don't get it. So that, I think, is one of the most important tasks to get in. What is it we want, and when do we want to achieve it?
Thank you very much, Bogi. And of course, as Lara has alluded to, we have had the Summit for the Future. I think some of us were highly disappointed by its outcome. It was a tremendously difficult negotiation, and it actually reflects what both you and Mr. Guterres have been saying, that at present it's very, very difficult to get multilateral agreements. But all the more reason to work at other levels and with other types of projects to actually move it forward until the world is able to come together again. And I do think mechanisms like G7, G20 and others contribute in some ways. We have regional initiatives, last not least, the EU, the African Union is really gaining strength from day to day and moving forward. And I really like the idea that Bogie ended with, who's catching up with whom? And thinking of the problems with German trains and and visiting China 2 weeks ago, I was sort of posing myself this question as well. So I think this learning also about solidarity, social contracts, what we owe each other from all parts of the world, we all have something to learn. And your point about, there is a history we all carry with us, and we all together have to overcome that history. There's a beautiful book called Westlessness that you might want to read on this matter. And thank you for coming to this session. I hope there's something you were able to take away. Thank you to the panelists, fantastic contributions, very lively. Thanks a lot. And thanks to those of you who gave us some additional questions and comments. Thank you.